Right, hey guys, it's that time of year. It's getting dark, and more and more people, as they arrive in at our centre, are becoming aware of the campaign we do this time of year on vitamin D. As you're aware that we have a functional approach to healthcare, and this time of year, vitamin D is something that we feel quite passionate about to highlight to our patients. Why vitamin D? Well, basically vitamin D is not a vitamin. It acts more like a hormone, and it's produced by the body. It's produced by the body with the skin's interaction with the sunlight, the UVB. So this time of year in the northern hemisphere, basically quite comfortably from probably middle of October, but even early October through into April, we just don't have enough sun or quality of sun to stimulate that production of vitamin D. Some people might argue that they try and get some vitamin D from diet, but it's generally suggested that many texts talk about that you probably can get only up to about 10% of your needs from vitamin D. So barring some medications and some conditions that people may have, it's pretty much suggested that vast majority of adults and children in the northern hemisphere this time of year supplement vitamin D. The challenge with vitamin D is dosage, and there's a lot of controversy or different texts which talk about different amounts of vitamin D and what dosage. The key with like most functional healthcare approaches is ideally not to guess. So we stock a test pack where we send off to an NHS lab for testing of the vitamin D. What that does is it allows us to test the actual specific levels of vitamin D, and now allows us to work out an appropriate dosage. Do we just need to maintain which would be an adequate ideal levels, or do we need to elevate them? From there we can work out a kind of 3 or 4 month dosage or schedule that we can then supplement, not only because we're not getting vitamin D through the winter, but we can ideally elevate that. The key with that is to get elevated levels, to get them up to optimum levels, and so that we then can go through summer and spring and summer and get to next winter, really coming into winter with an optimum level. So this is the perfect time to test your vitamin D levels and supplement accordingly through winter, knowing that you're not going to get enough or any vitamin D production, so supplementation is the only way, and work out the dosage so that you're not just randomly taking a guess and saying, well, I'll take any old supplement, vitamin D supplement, and that should help me through winter because I'm not making anything. You might actually be taking the vitamin D level so low that it's actually not having any benefit. So we really want to test that level of vitamin D and work out the appropriate either maintenance dose or a dose that's going to elevate your vitamin D levels. Very seldom do we get people which have vitamin D levels of toxicity. You're looking at really high levels of supplementation for a long period of time, but it is still possible. And also we don't necessarily want someone to read an article, take a high level, high potency dosage of vitamin D when they actually already have high levels. The interesting thing with vitamin D is that you would think that most people who have exposure of sun through the year will have high vitamin D levels. I've had a few patients who are active through the summer and outside, but because of the concern of sunburn and skin cancer, a lot of people these days are covering up. And because they're covering up, they're actually preventing or creating a barrier for that vitamin D production. Basically from April to probably the end of September, you really need probably around 20, 25 minutes, half an hour of sun exposure. It's generally in the northern hemisphere thought about between 11 and 3 o'clock. Obviously it varies from skin type and exposure, amount of exposure and how much sun on the day. But basically when your skin goes a little bit red and pinky, not burning, but it's reacting with it, that's when you produce a vitamin D. After that, we can use barriers or sun creams or covering up to protect ourselves from the skin. What we're finding is that there's a lot more documented cases of rickets coming through, or people coming into winter really quite deficient when they have actually been outdoors and exposed, but they're covering up and preventing that vitamin D production. So it's really a case of getting that vitamin D ideally tested. Some people look at it and say, well, I'm confident that my vitamin D levels are up. I don't really have any significant symptoms, so I'll take a maintenance dose. And there's certain guidelines with that, but those recommendations can vary quite significantly out there. So we'd always encourage people to speak about their vitamin D dosage with a relevant health care professional, and we're certainly happy to go through that with people in our centre when they come visit. So some of the considerations with taking vitamin D: if you're taking some medication for irregular heartbeat, like atrial fibrillation, or some diuretics, where people take diuretics for blood pressure, you might want to just double check that that's appropriate to vitamin D, or what your vitamin D levels are. And then also, because vitamin D affects calcium levels, people who have high levels of calcium, parathyroid issues, Hodgkin's and non-Hodgkin's lymphomas, kidney stones, a high amount of calcium within the blood system, kidney disease or so, would be cautious about taking vitamin D. Got to monitor those levels a lot more closely. So in summary, you're not going to get it from your diet, I'm afraid. We don't know your vitamin D status. Ideally, get it tested, get the right levels, because vitamin D really has been associated with a lot of different conditions, which give a variety of symptoms. So it's been associated with really helping to boost your immune system. High levels of vitamin D play a huge role in your immune system, which is obviously really important coming into winter. It's been associated with SADS along those lines because of the lack of sunlight and the vitamin D production. Again, some of those symptoms might be coming through. Even things through which you wouldn't associate, like weight management, mood, sleep disorders, imbalance in your circadian rhythm, your day-night rhythm, and through things to joint pain, and even all the way through being associated with things like learning difficulties. So if you're concerned about vitamin D, you're not getting that amount of exposure, get your vitamin D tested. We're happy to talk to you about that and guide you through that. Barring those medical conditions, barring those medications, looking into it, I'm not a fan of people just throwing huge amount of supplements at anything and covering up a bad diet or bad lifestyle. But we can say with confidence, taking away all those contraindications, the vast majority of adults and children in the Northern Hemisphere from now through November, December, January, Feb, coming into March, really our recommendation, backed up by the science and the general consideration now is vitamin D is something that we should really be significantly looking at. So we're ready to receive anyone who wants to take any information or get information. We have a campaign at the moment, vitamin D. On our notice board, we have information, and we do stock a vitamin D supplement. It's a very straightforward spray, very, very cost effective, very straightforward way to get the benefit of vitamin D this winter.